Today I am reading from the book Spirit of Homeopathy, book written by Dr. Rajan Shankaran. Philosophy, part philosophy, and chapter number 12, the scientific depth of homeopathy. What is holistic approach? The following, with a few minor correction, is an interview with which appear in the Homeopathic Heritage of June 1990. It resulted from the controversy initiated by the editor Dr. S.P. Kopikar, my senior colleague and a good friend. The issue he raised was that about the practicability of the holistic and psychosomatic approach in homeopathic prescribing. He went so far as to suggest that prescribing on the mentals and generals was just too ideal and not possible to the average. Not possible to for the average practitioner. Sorry, my friends, Mr. Gunavante was quite upset by the suggestion and felt the need to explain the standpoint of classical homeopathy so as to show its logic. He also wanted me to demonstrate that through from the some clinical cases and our fundamental principles are true and sound, and that we need to develop our skill to utilize them rather than the finding unscientific shortcut. This interview was much appreciated by several homeopaths, which shows me that doubts still exist about the practicability of the soundness of our principles. Interview now I'm reading the interview with Dr. R. Sankaran by S.M. Gunavante and published in the Homeopathic Heritage June 1990. In his editorial for February 1990 issue of Homeopathic Heritage, Dr. Kopikar has raised some fundamental issue in regards to the application of homeopathy, which I felt need to be discussed. For this purpose, I felt I could do not better than obtain the view of Dr. Rajan Shankaran, who I know well as an able homeopathic physician as well as thinker and teacher. Initially he felt it would be better not to enter a controversy, but on uh, my persuasions that such a discussions is in the interest of homeopathy. So he agreed to talk, and here is what he said. I have found homeopathy to be a tremendous tool to stimulate vitality and start true curative process. However, if we aim at merely giving relief to some symptoms, we are not exploiting its potential fully. So, if anyone says he has found prescribing on local symptoms or prescribing remedies as a specific for certain condition leads to much more curative effect than prescribing on the mental and generals, then our whole philosophy of our understanding of health, disease, and cure will have to be changed. So, but I feel sure it need not, because that approach will not work. Many minor problems are self-limiting. They get well even without medicine. But if an acute problem is serious enough, will it remain a local complaint to be tackled with a medicine which have a local action? No. Will not be the patient be ill as a whole and need to be treated as a totality. Anybody who was consciously practiced homeopathy would have felt how frustrating it is to give remedy after remedy and to see nothing really happening until it's find the one remedy which is absolutely correct and fits to the patients completely like a gloves. Unless this whole philosophy of homeopathy of totality is grasped and practiced faithfully, I am afraid homeopathy will not reach its true heights. It has been practiced with all kind of combinations, alternating quick change in the prescriptions, and with all the kind of specific and symptomatic treatment. As soon as one hear the word gas trouble, one tend to restrict his vision to the Lycopodium china and carbo vegetables. For these digestive troubles, and we tend not to think about the Nux vomica, Pulsatilla, or Lycopodium. I have been case where if only the practitioners had just seen a little beyond the local complaint, he would have unlock the whole case, but he did not bother to see. He kept on giving remedy which locally actions one after the another, giving only temporary relief and sometimes not even that. The principle of homeopathy are clear in starting that there cannot be one remedy for the whole patient and different remedy for each of his part. If a drug acts curatively, it will do so by virtue of its covering the mental, physical and general as well. Only remedy which acts on the organism as a whole can act curative or particular part of the body. For people with less mastery over particular symptom of each remedy, it is much safer to rely on the mentals and generals. A master might recognize tarantula cough, but most of us have not reached that stage. So we need to rely on the mentals and journals. This is safer also because the proving and clinical experience are not as complete in particular as they are in the mental and journals. One thing certain is that if the remedy does not cover the mentals and journals, with or without our knowing it, and it's merely fit particular symptoms, such a remedy often fails. We welcome an experience to the contrary. However, whenever a characteristic particular is found, we take the trouble to study the remedy to see what is mental and generals are, especially if no other remedy clearly fits. In this way, we are able to exploit even a small remedy. Let me make it clear that we do not advocate the ignoring the characteristic particular symptom, but on the contrary, we are only asking for the balanced view. But experience show that the mental and generals often chiefly determine the remedy, and this conviction has proved to be extremely valuable to us. Why were the masters successful? Probably their knowledge of drug was so profound that they could identify a remedy by looking at part of the individual. They could tell the difference in remedy and say from the tongue of nitric acid or fluoric acid, etc., and prescribe with a certainly based on the local symptom. Their identification was so good that they could select the right remedy, and from looking at the part, a remedy which unconsciously covered maintenance generals, but our identification not being as good, we choose a relay on the mentals and generals. Let me give some example in actual cases. Sorry, I was recently called to see a case which was diagnosed as a pneumonitis. This lady had continuous temperature for the past 3 weeks, and the temperature was not going down despite antibiotics and several homeopathic remedy. I was taken to see her by the homeopathic doctor who had already prescribed various medicines. There was a patch on the lungs, though the febrile symptoms resemble a malarial paroxysm. I was not able to get any characteristic symptom of the fever or paroxysm. Therefore, I was forced to rely solely on the constitutional symptom. She was a school teacher and was very anxious to get back to work. She was talkative and quite humorous, was known as the life and soul of the party. She was very hot patient, liked to take a very long walk and enjoy going out in the open air. She would get anxious about the various matters concerning her family. If we take the symptom loquacity with the jesting, which is mentioned in the synthetic repertory, and emulated by walking in the open air, and hot patient with the anxiety, we come to the Kali iodatum. I gave it 2 doses of 1 and 10 potency, 12 hourly. After second dose, she had profuse perspiration. 2 months have passed now and she is good at health. The kind of result is not exceptional. Case treated earlier with local remedies usually failed. When we prescribe Kali iodatum on journals such as loquacity with jesting, even in the case of severe leukoderma, we have been very successful, even though the white spots on the skin is not covered by this remedy. What do we mean by holistic treatment? What is the idea of giving Kali iodatum in leukoderma, or in the case of pneumonia or pyrexia of unknown origin? The idea of giving it is that what we are trying to treat is not leukoderma, not its pyrexia. The concept of disease in homeopathy is that the disease is total affection of the whole body and mind. There are no local diseases. That is what Hahnemann has emphasized repeatedly in the organon, that disease is nothing out of disorder of the vital force. He never said that in typhoid we have to treat typhoid, or the pneumonia we have to treat pneumonia. We have always to treat the person. That is the disordered vital force as represented by the totality of sign and symptom, not merely a local sign and the symptom. In case of cholera, we will certainly not sit down and ask about the patient's nature from childhood. In case of cholera, as in any acute cases, what we are going to see is the present totality. When a person is dying and breathing hard, has anxiety, fear of death and restlessness, we will consider those remedies which have these symptoms in the high degree. We need not always ask whether before he developed this state he was dictatorial or mild. That is the immaterial if the present picture itself is complete and clear. Each time, what has to be treated is the present illness as a whole. If we forget this principle and start treating part without the remedy covering the whole, then there are two possibilities. Either the remedy will not work at all, or it will work partially. If it works partially, it is going to suppress, and suppressions always lead to harm. This is a pure logic and it does not change, no matter how many prescriptions follow this practice. Tell us one more case. I know you have numerous cases to draw upon. It is not merely a numerous case, but every single case we treat is on this basis. Recent case, a lady was complaining of very severe headache which would start and go down with her son. They would be brought on by missing a meal. They were quite intense. She was taking around 12 tablets of aspirin every day. I asked her why she is taking 12 tablets. She said, "Doctor, some of them are for my headache and surely, but nowadays I have started liking to take the medicine. Even if I do not require that, I get pleasure out of swallowing the pills. I have some sweating after that and get a nice feeling. If I require 6 tablets, I take 12. And you also please do not give me 1 or 2 doses a day. Give me 6 doses or 8. This struck me so much that it looks up in the rubric in synthetic repertory. Medicine desired to swallow large dose of, and I found the medicine cactus, which also fits the headache symptoms. Her aggravations with the sun and worse from missing a meal were also found in the cactus. Cactus 200 completely relieves her headache. I will give you another case. A person came with a fever since over 1 week. Temperature was around 102 Fahrenheit. He was an old man of a 70 plus. He came to me at the clinic with his son. My female assistant was also there. He was not so neatly dressed. He sat down and said, "Doctor," on gesture was like a commanding us. "I know that this fever is due to the cracks on my penis. It is due to that. This is the infection that has created the fever. You treat that and I will be okay. I know that. Don't try to handle anything else." In this, I could see 3 prominent symptoms. Firstly, egotism. Second is theorizing. And third was crack on the prepuce, which had nothing to do with fever, even though he insisted to fever was due to the cracks. When you take a theorizing, egotism and cracks on the penis, you get only sulfur. The way he said it is a presence of in the presence of female assistants and of his son shows a kind of indifference to his own personal appearance. He did not bother how it looks. It was not actually a shameless behavior, but a kind of indifference to appearance, which is not just the clothes. It is a sulfur who say, "I don't care, damn that they think of me, or I will do what I wish to do." On this basis, I gave him a dose of sulfur 1 m. Very soon the fever and everything subside. You don't have to give many doses. When you prescribe like this, 1 or 2 doses are enough. Have to give many doses. 1 or 2 doses are enough. Look at the state at the time. It is not that he was sulfur even 10 years ago. He was sulfur right now. And then even during his fever, any other remedies given at that time either will do nothing or it suppressed. You have to appreciate one thing, that is disease is a dynamic affection. Only one affection can exist at a time. If his affection is sulfur, it is sulfur and nothing else. A man can be only in one state at a time. Is there any possibility that after several months he may come with a complaint about which the doctor will take a different view? Yes, you have to change the remedy if the mentals and generals change. What do we mean by mental and generals? By that we means those things that are totally dissociated with the pathological and pathognomical symptom. Now this can be keynotes also. What is keynote? It is something which does not relate to disease pathology. If you are going to take something that belongs to disease pathology as a keynote, you are counting trouble. But if you are going to select remedy that are characteristic for that particular patient and that will differentiate one patient from another patient, then your keynote will be useful. Naturally, the keynote should fit in with the mentals and journals. You cannot have a patient with a keynote of bryonia and the mentals of rust toxicodendron, or a keynote of the sulfur and the mentals of veratrum. They have to be same. You can either approach from keynotes or from the mentals and journals, but the circle must be completed. Some people find it easier with keynotes, but those who think they can prescribe on local symptoms or keynotes or on the pathognomical symptoms are badly mistaken. Naturally, if I examine a sulfur patient, he might give aggravation from the covering his feet at night. He may also have an intolerance of hunger as well as aggravation from the standing. These are all keynote which are written in 3 marks in Allen's keynote. What are those keynote? They are also symptoms that are removed from the pathological process. Thirst during fever is not a keynote. Keynote are uncommon symptom. Uncommon symptom indicate the general state, the nature of disturbance of the vital force, and hence the mental and generals There is no disagreement about them. But they have to fit in together. If we are able to confirm the keynotes with the mentals and journals, the prescriptions become 100% conform, and then our case cannot be go wrong. We insist on mentals and journals because here there is no chance of mistaking the pathognomical and non-pathognomical symptoms like egotism, theorizing, and indifference to personal appearance can be no stretch of imaginations. Be a part of the fever by no stretch of imagination in a predominantly physical case. Can a mental and general symptoms be a part of pathology? That is why reliance on mental and generals is much safer. But if one is very good at perceiving what is characteristic and what is not, he can definitely use those local symptoms too. Hahnemann said in aphorism 153 that uncommon peculiar symptoms are most important, but how many prescriptions are made on this basis? If one give arsenic sulfavum again and again for vitiligo, are we prescribing on something uncommon? But that is what many homeopaths are doing. If we prescribe in every case of the cervical spondylosis 1 or 2 peculiar medicine, is that the legacy of Hahnemann? No. And the questions is asked, was Hahnemann holistic? Certainly he was holistic. Can we find one word is Hahnemann's writing where he said, do not prescribe on the characteristic, do not prescribe on mentals. On the contrary, in aphorism 211, he say, this holds true to such an extent that the state of dispositions often chiefly determine the choice of remedy. In fact, Hahnemann came to this conclusion after several years of experience. Anyone who say that aconite is good for fever, canthal is good for urinary trouble, rust for the joint pains, and mercurus for dysentery is taking of absolute pathology. He does not follow Hahnemann's and ignore the teaching of the more successful practitioner who follow him. Last month, I had a case of iridocyclitis for whom I prescribed the iodine. Why? Because the patient was hungry and every 3 hours, and he had a kind of anxiety that made him walk around. He must walk fast in open air to get rid of the anxiety. He felt extremely hot. He was told that he would become blind if he does not take a cortisone. Yet he got totally well with the iodine 200. I did not even care to see if iodine has got any eye symptom or not. You can prescribe with the absolute certainty. You can prescribe with the absolute certainty if mentals and journals are agree. Everything else is a matter of chance. That is why from Hahnemann's downward to Warning His Sons, Bogart, Scant, Sir John Ware, Margaret Taylor, all these great names are known. The one true method of prescribing on totality, understanding the mind and general of the patient, his peculiar and the individuality of his being. Only this method really has stood the test of time, because every other method is a chance. I treated a case of fibroid of uterus with the arsenic alb, and that tumor went away. And arsenic alb is not mentioned even in a single grade for the fibroid of uterus. Why? Because the patient was fastidious and had a compulsive neurosis, was extremely anxious about the health, very chilly, very lean. All the symptoms of the patients fitted into the arsenic alb except fibroid. If I had started with the remedies known for fibroid, this lady would never have got well. Nowadays, we have to good fortune of treating many patients coming after taking innumerable homeopathic medicine. Sometimes they were given the high remedy, specific remedy, but it was quickly gone down. Thus, is what happened when we try to treat symptom one after the another. Even if they have fit the right remedy, there is no faith in it. They prescribe on some symptoms, and when symptoms has not improved, they change. But if we knew that the remedy fit the mentals and generals, they would not have changed, and that remedy would have ultimately cured the case. I can give some more example in which mental symptoms alone led to the curative prescriptions. A case of pituitary tumor was taken for operation. The patient ministers in West Bengal's government developed a symptom of a heart failure every time he was taken to the operation theatre, and hence he had to be taken home. On the basis of fear causing heart failure, Dr. B.N. Chakrabarty told us the prescription of gelsemium. Cowardice, anticipatory anxiety, fear of operation, where other symptoms are. Gelsemium is not known to have a cured tumor, but still it did when it was prescribed on the mental symptoms, and patient was absolutely okay. The Sarabhai Kapadia has a case of molluscum contagious. He took a full history but could not get any characteristic symptom. After an hour of taking the case, he showed the child scratching the head. The mother said that whenever the boy is sleeping, he does this. On basis of Kent's repertory, head itching of scalp, sleep when going to. Dr. Sarabhai prescribed the Agnus cactus, and the molluscum disappears soon, though the remedy does not cover the complaint. In his article, Trend of Thoughts Necessary for Comprehension and Retention of the Homeopathy, Kant's Lesser Writing, page number 598, Kant has given a number of examples from his practice to support his assertion. Find the remedy for the patients and it will cure him, and the particular will disappear though none of them were in that remedy. He says again, most cases of hip joint disorder cured by me in the past 25 years were cured by the remedy not in the hip joint list. Further, a patient with a rectal ulcer who was advised operation had the persistent mental symptom like intense strain to prevent himself from the self-destructions. Natrum self has these symptoms, but it has no rectal ulcer recorded. A few other symptoms together with this strong mental led to Natrum self, and he had no more hemorrhoid. He concluded by saying emphatically, guided by the symptom of the patients, you can cure the inflammation of any part even if that remedy has not produced inflammation of that particular part. A German journal once reported a case, I think it was von Keller. It was a case of uterine tumor treated with the ethusa on the basis of two symptoms. Whenever the patient would close her eye to sleep, she would get a strong feeling that she will not wake up next morning. And when she gets up in the darkness, she feels breathless. A case of severe cough taught me much about the importance of the mental symptom. The cough would not subside even after several remedies were tried. The parents were getting anxious. The child was restless, very stubborn, and did the opposite of what he was told to do. On the basis of that, tuberculum is good remedy for the persistent respiratory complaint, restlessness, obstinacy. It was given but did not work. One day, when the boy was sitting in my clinic, suddenly he did something very funny. He shouted at me, "Hey Sankaran, your medicine are useless. Better give me some good medicine, good medicines, else I will not come here." This coming from the boy of the 5, uttered in a violent, threatening tone, was shocking. I gathered from the parents that his behavior at home was funny. He was disobedient, shrieking, mocking, quarrelsome. He was intensely restless. He threw things or destroyed them. However, he reacted to music favorably, would dance to tune. It was not accustomed to thinking of tarantula for cough. But after failure with the indicated remedies, I was in a chastened mood. Maybe I thought, when tarantula covers the mind so well, it may cover the rest of the symptom too. The response to tarantula was magical in 2 days, whereas I had just suggested over it for weeks with other remedies and failed. Even his behavior improved. The case illustrations to me how our mind oriented to therapeutic miss the right remedy. It is worth referring to Dr. Segal's method of the revolutionized homeopathy. He practiced exclusively on the mentals, whereas we include the physical generals and concomitant. The first case from which Dr. Segal learned was malaria. The child was wanted to vomit but could not. He was irritable and nux vomica failed. Dr. Segal observed that the child did not want to get out of the bed, and yet he did not have any complaint. Indifference does not complain. Bad desire to remain in. Hyoscyamus 30 cured the boy. Homeopathy is not something mechanical. It is an art. It is an art. It is an art of observation and understanding the process that is going on within man, which is the disease. It is not for the nothing that Hahnemann's one case which was reported was case of Wart, which was cured with the chamomilla. Can we think about whether Hahnemann was holistic or not? Hahnemann was a man who laid the foundation of holistic therapeutics in the history of medicine. He was the first to the link the mind with the body, the first who said that disease is the affection of the whole, not the part, the first who said treatment of the skin alone is suppression. He was the beginner of the holistic therapeutic in the history of medicine. We are proud that we have such a visionary as our master. Remedies for particular disease conditions means therapeutics were advocated even in Hahnemann's time, and he was a strong critic of them. Let us use this divine tool for the higher purpose for which it was revealed to Hahnemann.